Thank you for viewing this recording of a free event provided by Next Village San Francisco for our community. Next Village San Francisco is a local nonprofit providing services and support that empower seniors to live independently in their own homes. We welcome people who want to keep connected with their community as members, volunteers, and supporters. We host 30 to 40 free activities and events each month for the public, and our members have access to our network of volunteers. Learn more and get involved at nextvillagesf.org. We hope you enjoy this video.
Okay, good afternoon, everyone. I'm Jacqueline Zimmer-Jones, director here at Next Village San Francisco. And with me is Donna Boer, who is the director of our sister program, District 2 University. And today's presentation is being provided by Cho from Compassionate Community Care. And she is going to talk to us about care management and also about a tool called CareLink360, which is a new technology that connects families and caregivers and professionals to individuals who are aging in place and need some support, and technology is a great tool for that. This technology is a great tool for that. So I'm going to just turn it right over to her. And I suppose if you have questions, you can put them in the chat and I'll watch for those. And otherwise it's there. Again, there were more people coming, but we may be able to be just at a level where you can ask questions as we go along. But if not, nothing else, we'll certainly have time at the end. Does that sound all right? Okay, Cho, take it away.
Okay, thank you. Let me share my screen. Okay, so compassionate community care is the trusted choice for home care and care management in San Francisco for the last 2 decades. We provide home care and care management. So I'm going to start with the geriatric care management, which is a very important component. Everybody is a unique individual, so it's very important to provide the customized, personalized care management. There are a lot involved in different part of our life and different part of our care. That's why it's very important to have somebody who is specialized and working with the elderly people to help them to get the care they need. So there are different components or different products in geriatric care management. Like say, home from the hospital. Often people go in and out of the hospital, or many people may have dementia or Alzheimer care, and that can be a pretty long process, can be very frustrating and challenging. And also we have geriatric assessment. I'll go into a little more detail about what's assessment include. And also have quality of life, care management, personal care plus, medication management, which is a very important component. As we get older, we may likely to have more medications. Often it's pretty complex. And home safety is very important. We want to make sure prevent fall, because fall can be one of the leading cause for ER visits. And we also have VIP client care management. Relocation, as we get older, some people would like to move from their home to a facility, or some people, they may ended up want to relocate out of the city. So it's important to have people who can help coordinate to move to the place where they want to. Bill management is important. Sometimes it gets overwhelming for people to manage their finance when we get older. And we go through different stages of a life. And then when we go to the end of life, which is very challenging, that's an important service we provide. So our approach to care is to build the trusted relationship. It's very important. We have open communication and collaboration with different families, and sometimes they have like a family dynamics. We are good at working with dysfunctional family if that's needed. Education and advocacy is very important because it's very important to educate and empower the family member or the client themselves or the loved one to understand um, what's going on, what's available, and help to make a right decision or informed decision to see what's the best for them or their loved one. And we also provide customized services to each unique individual because everybody is different and their need is different, the expectation is different. So that's why it's very important to provide client-centered, personalized care. We also work as a liaison with the families, especially for those who is far away out of town or even out of the country. We focus on preventative care because it's very important to be proactive to prevent the crisis if all possible. And that help reduce the risks and also improve the long-term health outcomes and also help improve the quality of life. So there are key collaborators with the geriatric care managers. So geriatric care manager is a very specialized field, geriatric care management, or we call GCM. So we can work with discharge planners, like often when people they're in the hospital or they're in the acute rehab facility, or people call skilled nursing facility. So a care manager can help ensure the smooth transition from the hospital or a rehab facility to the home. And also we can coordinate a lot of post-discharge care. So people may need equipment, follow-up appointment, medications, so on and so forth. We may also work with conservators, or if people they don't have the capacity, they're conserved by the court. Or we work with the fiduciaries or power of attorneys or trustees. So in that way, we can help them to manage their finance or legal affairs accordingly. We can also collaborate with more comprehensive care and the legal issues. So for the family who have long distance family members, then they will rely on the GCM to help caregiver oversight and also have regular updates about what's going on about their loved one. We want to make sure the well-being is well taken care of from far away. Some clients, they don't have immediate family. So that's why it's so important to have a GCM to help provide the care coordinations and connect with all kind of different necessary resources. There are many healthcare providers. When we get older, when we get sick, so we need to collaborate. And also there are attorneys and the financial advisors we need to coordinate with. So working with a care manager is important to help connect all those parties together and all the necessary services. I don't know if you heard about Adult Protective Services, which is a agency or department under uh, Department of Adults and Disabilities within the city and county of San Francisco. They're a great organization to provide services to help protect the elderly people in case if there's abuse or neglect or exploitation. And we've been working with them a lot to help provide the safety for our elderly people and prevent any abuse or neglect. So where and when can I count on a geriatric care manager? So a geriatric care manager can travel to the home, hospital, or different medical appointments and also can accompany the client in different outings and social events. And it's very important you have the GCM who can be available 24/7 for emergency issues or urgent issues. And we have professional care managers to be on call to cover emergencies or urgent issues. And geriatric care management is a highly specialized field because our clients, they are unique and they may have different health conditions. It's pretty common for people to have dementia, Alzheimer, or many other chronic conditions like with the heart or lung, or some people have diabetics, all kind of other situation where people may have may be on like a dialysis or chemo. Um, the list goes on. Or people may um, have fracture, have transplant, many different conditions. And also we specialize in effective crisis management and if intervention. And some people, they may have hoarding tendency. So it's very important to offer some strategies which is effective and help our client to live in a safe environment. There are many benefits to hire a geriatric care management. I'm just name a few here. It helps save time and money because it can be very overwhelming with so many different services. Later on, if time allows, I can share a few about elder care options. So with the help of GCM, can make informed decision and reduce some unnecessary costs and less overwhelming. And the healthcare or medical system is quite complex. So with the GCM can help navigate the complex system. Is so some people may see geriatric care management as healthcare navigator. So simple way to put it. And also GCM may help prevent hospital readmission. By doing that, we provide proactive care management and reduce some of the risk factors for hospital readmission. As we mentioned earlier, like fall prevention, for example, is one, and also medication management and meals and nutritions, many other issues. And the GCM may also help advocate for the elderly people or the loved one to see what is most important for you or your loved one, what it matters. Because it's very important, it's overwhelming with so many things. It's easy for us to lose the control, and also we get confused about what to do and what is most important to do. So that's what GCM help you to sort through and prioritize what is most important, and also find the proper care support that you need. Because there's so many services out there, so you don't know sometimes where to start. And also GCM can help reduce the crisis through preventative care and holistic care. Because each one of us, we have not only our physical care need, we also have our emotional, spiritual, and cognitive needs. So here are the key benefits of working with a geriatric care manager. We want to prevent crisis and also assessment. There are a lot of issues we need to consider, like for example, the meals. I mean, that's very important. And nutrition, because different people, they may have different nutrition needs, or some people they have some diet restriction. Like for example, people they may have different health conditions like heart and the renal issues, or diabetics, um, different issues. Then we need to take into consideration. And also want to assess people's memory, they're good or not, and also their medical condition, the mobility, and what is important to you, what matters to you, legal issues and financial and many other issues. And then we can help you coordinate the care. So in that way, you have a seamless transition or coordination of the care you need. And we make sure it's important to have the personalized solution. It's not like the same. It's not like go to McDonald's, you get the same McDonald's. Everybody are different. So we need to have a personalized solution for each individual one of us. And there's so many resources out there in the community. And that's GCM can help you to reach to the services that you need effectively and save your time and money. And also GCM can provide ongoing support for you. It's like hold your hands through the complex healthcare conditions and different situation in your life. So there are many different services out there, different organizations out there too. So what make compassionate community care special? We have a very caring, competent, professional, supportive team, and we are committed to provide the highest quality care at home for home care and geriatric care management. And we have a holistic approach with preventative focus. We make sure to take care of people's body, mind, spiritual needs, not just their daily physical care. Another innovative approach that compassionate community care we have is CareLink360. It's our digital health companion that keeps the family involved, connected. One of the concerns people have is the isolation at home. CareLink360, they bring the family together. The family cannot be with each other all the time, but through CareLink360, we can share the videos and can share the photos and also connect with the people, the family member, the friends in lifetime. It's a touch screen, 15 inches device, voice activated. You don't need to enter the code. For people who have trouble remember the code or have vision issues, they can just voice activate. So you can talk with a loved one when you are in front of this CareLink360. And it's often people, as we're getting older, we have so many things. Well, memory is not the best. Well, CareLink360 can set up different reminders for medications and hydration, nutrition, and time for doctor's appointment or time for exercise, so on and so forth. And CareLink360, we focus on, just like I mentioned about holistic care, promote the 5 pillars of wellness program, the safety, and the body, the mind, and the wellness, and all that. We also provide culturally sensitive care. We're in San Francisco. We are a very diverse town. So people, they may speak different languages. We have, in our agency, we celebrate diversity. We have employees speak different languages. Um, they understand the different culture. So in San Francisco, it's very common people, they may speak, in addition to English, they may speak Spanish or Cantonese or Mandarin or many other languages. We want to help people feel comfortable because it's important. We help people in their home. We want to provide them with the care and the support they want with the people they feel most comfortable, and also cook the food they like because food is comforting. We deliver the client-centered care and personalized care. And it's very important you want people that are trustworthy. So we build a trusted relationship with people that we work with, our clients, family, and then colleagues. And we're very responsive. We understand time can be very critical, especially when people they have urgent issues or emergencies. We need to provide the guidance and support right away. And we specialize in caring for people with different kind of health conditions like dementia, palliative care, or end-of-life care. Or some people may hear about hospice care, which is very important, and many different kind of chronic conditions. And it's important for people to receive both home care and geriatric care management if you need that together. And of course, we can provide either or, but if you end up need both, That's cost effective to have both under one roof. And we've been building the family together with our employees and our clients and our colleagues. So we see our employees and clients and our colleagues as part of a family. Before COVID, we used to have annual anniversary celebration party. We used to have like 200 or 300 people. It was a great party. Okay, so I would like to bring to your attention one, you need to consider care at home for your loved one or for yourself. You don't want to wait for a crisis. It's important to plan ahead for peace of mind. We're talking about proactive. So you may consider to start small with maybe just a few hours a week, for example, 4 hours a week. That may help prevent the accidents and falls, which may lead to fracture and possible many other serious complications. That will really affect negatively of our quality of life, and also it's very expensive when that happens. And we all want to keep our loved one at home, safe and comfortable. Here are a few signs when it's time for you or your loved one need help. They're forgetting the routines, or they may repeating the same questions or same issues again and again and again. And they may skip the meals or forget about to eat or drink or take medications. Or they may rely on the frozen meals, not able to shop groceries as you or the loved one used to do, and have difficulty walking safely, and the balance is not good. And also needs help to get around, but there is no help. The home gets messy, the hygiene is poor, and the laundry piled up. And people that may feel scared or suspicious or really worried somebody may moving things, or they are afraid of they will be evicted from their home or apartment, or afraid somebody is trying to harm them, or a fear of being alone, or the withdrawal from the favorite activities or events they used to go to, or they have trouble maintaining basic daily tasks or essential tasks. So either one of them or more, then maybe the sign is time to explore the care at home. Any of you have any questions so far?
Joe, were you going to show us a little bit about how the
CareLink, let me show
CareLink
you.
works?
Yes.
I don't know if anyone has any questions, but I think.
Let me share the CareLink.
Okay.
Hold on just a minute.
And most of us are kind of pretty familiar with aging and all the components to it. So.
Oh, okay. Okay, let me
Yeah.
share with you the CareLink360.
Thank you.
Sure.
Hi, Sylvia.
Oop, hold on. Hold on. Let me share.
One of the reasons that I was interested in compassionate community care is they had kind of an hourly rate for folks. They didn't require everybody to have, 3 times a week, 4 hours a day minimum. And their extensive case management service is really unique to a lot of home care agencies.
Thank you. So do you see my screen?
Yep.
Okay. So that's the introduction about CareLink360.
Oh, I cannot hear her.
Oh, sorry. Let me.
Thank you for choosing our home care agency that truly embraces innovation to serve your loved one. By working with us, your loved one will be supported by a team that not only cares deeply about older adults, but also demonstrates a strong commitment to excellence through ongoing training and certification. Most members of our organization have completed the CareLink360 Partner in Care certification program, which highlights their dedication to delivering high-quality, person-centered care. This certification places our agency among an elite group of organizations in the industry, ensuring that your loved one receives care guided by quality practices, compassion, and innovation. By introducing CareLink360 technology, our agency is removing the guesswork from care and replacing it with real, meaningful data that supports our care plans. This gives you, as a family member, greater visibility and peace of mind, knowing that you can be informed of your loved one's progress, stability, or changes in their condition, while they remain supported with dignity, compassion, and independence. Caring for a loved one can sometimes feel uncertain, especially when updates only come during doctor visits and often in unfamiliar environments. This non-data-driven approach can leave families guessing about what's really happening day to day. With CareLink360, data supports the extended care team. CareLink360 provides visibility through data about your loved one's well-being, allowing the care team to make timely adjustments instead of waiting between check-ins. For you as a family member, this means less uncertainty. You gain clear insight into your loved one's condition, stability, and progress. Confidence in care. Data guides decision-making, so you know their care plan is always current. Peace of mind. You stay informed and engaged without adding stress or complexity to your day. CareLink360 ensures that your loved one is not only safe and supported, but also thriving, while you remain an active and informed partner in their journey. When building an effective care plan, it's essential to remember that health and well-being are more than just physical needs. At CareLink360, we focus on the 5 pillars of care: safety, nutrition, physical health, cognitive health, and emotional health. These 5 areas work together to create a foundation for stability, dignity, and quality of life. These 5 pillars guide how we support older adults in every care environment. Whether it's providing reminders to drink water, exercises to stay mobile, brain games to stay sharp, or music to soothe emotions, CareLink360 covers the whole person. Let's review each of these pillars in more detail. Let's take the first pillar, safety. Falls and accidents are a major risk for older adults. With CareLink360, we can send visual reminders to reduce risks like turning on lights, moving carefully, or taking medications on time. Staying active and hydrated are equally important to building strength, which helps prevent falls. The DHC makes this easy with exercise routines and reminders that support daily stability and safety. The goal is simple: fewer preventable incidents, more peace of mind. Nutrition is another area where older adults often need support. CareLink360 provides reminders for mealtimes, hydration, and even special diets. Imagine your loved one being prompted, "Time for your lunch. Today is a heart-healthy meal." Or a reminder in the evening, "Don't forget your evening snack." We can also show educational videos about nutrition, helping older adults make healthier choices and reinforcing care team recommendations. This keeps nutrition front and center without adding to staff workload. Physical health is critical. The DHC provides videos for light exercises, stretching, and therapy routines. These are not just general exercises. They can be tailored to rehabilitation needs. For example, a person recovering from surgery can watch and repeat therapy exercises between sessions, reinforcing what the therapist taught. This increases consistency, helps with recovery, and makes your loved ones more active participants in their own care. Cognitive health is equally important. The brain needs exercise just like the body. CareLink360 offers brain fitness modules that span all levels. For persons with memory care needs, we start with simple activities like Reveal by Touch, where engagement is gentle and intuitive. For more independent individuals, we offer jigsaw puzzles, solitaire, and word searches. We can even provide advanced cognitive modules that target attention, processing speed, and working memory. The key is that every person, regardless of ability, has something stimulating and engaging at their level. Emotional health. This pillar is central to well-being. CareLink360 supports emotional health in multiple ways. For persons with memory care needs, soothing videos of babies, cats, dogs, or birds can calm agitation and bring joy. For others, favorite music or family video messages offer comfort and connection. Families can also connect through video calls, bridging distance and reducing loneliness. This emotional layer makes a powerful difference in quality of life. CareLink360 is more than just a device, it's a care program. Families, caregivers, care teams, and older adults are all connected in one secure environment. The centerpiece of CareLink360 is our Digital Health Companion, or DHC. It looks like a simple device, but it's been designed from the ground up specifically for older adults. For families and care teams, they use the CareLink360 companion app that they can install for free on their smartphones. Next, we will review both of them in detail. The CareLink360 Digital Health Companion, DHC for short, is a purpose-built device designed to make technology simple, supportive, and accessible for older adults. It features a large 15-inch touchscreen that is easy to see and use, along with loud, high-quality speakers and a front-facing camera for effortless video chatting with family, friends, and care teams. Unlike tablets or computers, the DHC operates on a closed, encrypted, password-free network, ensuring security, privacy, and ease of use for the individual. Core features include daily reminders, gentle prompts for medications, fluids, activities, and appointments, wellness content videos and activities that promote physical and emotional health, video chat simple, one-touch access to connect with loved ones or care teams, educational and spiritual media, access to uplifting, engaging content tailored to the individual, cognitive games, a wide variety of brain fitness modules from simple to advanced to support memory, attention, and problem solving. The DHC serves as a constant companion that not only supports daily routines, but also enhances connection, independence, and overall quality of life. Why simplicity matters? One of the most important things to understand is that many older adults struggle with mainstream technology. Apps, logins, tiny buttons, confusing menus, all of these create frustration. The DHC eliminates those barriers. With just a touch, older adults can access activities, reminders, soothing videos, or calls from family members. There are no passwords, no complicated steps, and no chance of accidentally breaking the system. This simplicity is what makes the device accessible to people who otherwise would never use technology. The CareLink360 companion app is the secure, easy-to-use mobile tool that keeps families, friends, and care teams connected to their loved one through the Digital Health Companion, DHC. It allows trusted individuals to share, support, and stay informed, no matter where they are. With the companion app, you can send photos and videos, share special moments instantly to bring joy and comfort, schedule reminders, create and manage prompts for medications, hydration, appointments, and daily activities. Enjoy two-way video calls, connect face-to-face with just one tap, bridging distances and strengthening bonds. Receive well-being, check-ins notifications, receive real-time alerts from the DHC for well-being checkups, ensuring peace of mind and shared responsibility. The companion app turns care into a true team effort, empowering families and professionals to provide consistent support while helping older adults feel engaged, connected, and never alone. The companion app is your personal connection to your loved one's CareLink360 Digital Health Companion. It's simple, secure, and designed to keep you engaged in their daily care journey. Let's walk through it step by step. First, you'll download and log into the app using the credentials provided by our agency. This ensures you're connected to the right account and part of your loved one's secure care network. Next, you'll personalize your profile so that your loved one knows exactly who is in their family circle. A friendly name and photo make every interaction feel more personal. Then comes the fun part, sending your first photo or video to your loved one's DHC. Imagine the joy your loved one will feel seeing a familiar smile, a family celebration, or a favorite memory pop up right on their screen. You'll also set up reminders or well-being checkups, whether it's a gentle nudge to drink water, take medication, or simply check in with, how are you feeling today? And of course, you can have video visits directly through the app. This makes it easy to see your loved one's face, share a conversation, and feel connected no matter the distance. Finally, you'll be able to invite other family members to join the secure, closed network of trusted family and friends. This way, everyone who matters can stay connected, contribute, and share in supporting your loved one. Now, you are fully equipped to use the companion app with confidence, making it simple to stay in touch and actively engaged with your loved one's care journey. Your participation is an essential part of the CareLink360 ecosystem. By engaging with the companion app, you can stay connected daily, support your loved one emotionally and socially, Collaborate with caregivers and our agency on meaningful care goals. Together, we create a circle of support around your loved one, helping them stay healthy, happy, and safe at home. Thank you for giving us the opportunity to care for your loved one. By combining innovative technology, certified caregivers, and family engagement, you've chosen a solution that honors your loved one's dignity, independence, and quality of life.
Okay.
Thank you for sharing
You're
that.
welcome. Sure.
Anybody
Thank you
have,
for mentioning it.
yeah, anybody have any questions about that?
I have a question about the for both the CareLink and for the geriatric care management. Is this insurance approved?
That's a good question. Insurance, most of the I would say insurance do not cover this service. Insurance, unless you have private long-term care insurance, may possibly cover, but to the best of my knowledge, is mostly out-of-pocket private pay.
Okay. And for your organization, are the rates based on the level of involvement that we're asking from your care team, or is it flat
That's
rates?
That's an excellent question. Yeah, it's built by the time you spend. So we have
Okay.
like start with a 1 hour minimum. We
Mm-hmm.
start with a comprehensive assessment, so identify the needs. We have people they only need like just one time consultation. They want to
Okay.
plan for like baby boomer. They want to plan for the future because they don't want to cause burden to their children. So they want to plan ahead. So we give them some guidance for consultation, maybe
I
an
see.
hour and a half, right? But we also have clients they need more ongoing care. So then the ongoing care, they don't have like we don't have to charge them like a certain amount. It's just go as they need. Let's say they
Okay.
may start with 1 hour care, like for example, um, somebody they're preparing um, the loved one, they because it's overwhelming for an elderly couple, right? So they want and this person's condition is declining. They want help, like coordinate different doctor's appointment, or they can go to the hospital in and out, coordinate equipment, and so on and so forth. So for that, let's say we have like 1 hour initially, then afterwards we have 15 minutes increment. So
I
they may
see.
have like only 15 minutes or 20 minutes, that's okay. But afterwards, we do have a 15 minutes. But for people who have cost concern, let's say want to make a phone call, we may ended up get a voice message. So
Mm-hmm.
usually we don't charge that. Technically, we can charge 15 minutes per
I
contract,
see.
but
I see.
we don't do that. For people we help them save the money. So we for small things like that, and then we just add it up together for like a 15, 20 minutes, things like that. We're just trying to save money for our clients
I
when the
see.
people there have the financial concern.
And CareLink360, same question. Is it insurance based? Is it Medicare, Medi-Cal, or is it out of pocket as well?
It's out of pocket. It's part
Okay.
of a service, so you don't need to pay additional.
Yes.
So when people use our service like home care or care
Oh, I
management,
see.
so it's part of the fee.
I
So it's
see.
part of
Okay.
it's a important component of our service, which is innovative. So far, I haven't heard anybody else using that.
And can you use the CareLink360 as a standalone, or
It's
is
a
it
possibility. It's a
okay?
possibility. Yeah.
Great.
Yeah,
Thank you.
we heard some people they may just they start with the short term, but then they're all connected with their family and friends, whatever. It's okay. Service ended, which means we need to remove the care link. They say, well, wait a minute, that's part of their family now, because that's
Yes.
how
Yes.
the grandkids and with grandparents they connect. So they want to use that, and also they want to maintain like a help check-ins when they need
I
help.
see.
So they
Right.
may charge for a certain fee, and then so keep the device. That's a possibility.
Thank
But in
you.
general, it's sure, you're welcome. We're flexible. We're here to just support people, whatever is the best for them.
Thank you.
Good.
That answered my questions. Thank you.
Yeah.
Thank you. Good question.
it's just such a helpful tool. Can you who, like if you have physical therapy, who uploads that to the device?
The family, or we can help upload.
Okay.
That's a very good question. Yeah, so in that way, because that will with the real data, they can track and to see if the how long they get a exercise or activities, and also
Yeah.
with their scores and all that.
Yeah.
Great question.
Okay.
That's why people get so excited, because some people they think, oh, I may not have that much to do, but when they have all these things going on, right, after they basically cleaning or laundry, well, they can do exercise together. They have sing along or they have breathing exercise, all in this CareLink360. There are many different um, activities involved, and
Mhm.
yeah, and also we can upload whatever they're interested. Let's say, for example, we have people, this CareLink360 is 100% supported with English and Spanish. But if people, like, for example, speak other language, Chinese, for example, then they can enter, the reminders can be in Chinese as well. Or if they have some videos or music they want to be loaded in the CareLink360, we can help do that too. So in that way, it's more personalized, and they can have whatever music they like, they feel comfortable with.
So they just need to have Wi-Fi.
Correct. They just need Wi-Fi. Yeah. And that really helped break the isolation of the elderly people.
Mm-hmm.
And especially now with the holidays is coming, it's very hard for the elderly people. But now with that technology that bring people together. And also if they need help, like for example, they can even have appointment with the doctor if the doctor want to have that. That saves their time, because sometimes like iPad, for example, they don't know how to use that, but this is in
Mm-hmm.
front of it.
Mm-hmm.
But if the doctor is willing to like just have an app in their phone and then they can connect with the patient, that also helps save the time for the visit, because doctor may not visit them. Here you go, you can see them.
Yeah. Okay. All right. Any further questions from folks?
I have a bunch of questions.
Okay, I'm going to go ahead and stop the recording if that's okay, and you
Sure.
can go ahead and ask freely. Thank
Okay.
you.
Thank you for viewing this Next Village video recording. We hope you enjoyed it. Please help us spread the word and tell friends and neighbors about Next Village events and services for seniors and adults with disabilities in San Francisco. Visit our website to learn more about our vibrant, growing network, as well as to view our calendar of upcoming Zoom and in-person events and activities in San Francisco. Our website is nextvillagesf.org. Contact us to join our email list to learn about events and resources for seniors in San Francisco. And subscribe to the Next Village YouTube channel by clicking the button below.